Hey everybody, welcome to Pic Dr. Osborne's Brain. Got a great show for you tonight. We're going to be talking all about the mouth, right? Gluten in the mouth, oral symptoms, what you need to look for, what you should be concerned about. And this is one of the topics, really, it's super important because kids tend to find or have these types of findings. And so where we learn a lot about the oral manifestations of gluten sensitivity are actually from dentists and dental research. So in that regard, we really want to know what we can look for in our children's mouths that might be an indicator that they could be intolerant or sensitive to gluten long before the manifestation of major illness like celiac disease or other forms of autoimmunity. So tonight we're going to be talking about the oral symptoms of gluten exposure. And again, whether you're a parent with children or whether you're an adult and you're having struggles with oral hygiene or oral health issues, this is going to be an episode you don't want to miss. Stick with me to the end. We're going to talk about vitamins, minerals, and oral health, what you can do naturally to make sure that your mouth and your teeth and your dentition are super well taken care of nutritionally so that you can thrive as opposed to survive. So, as usual, if you're new to the show, say hello. Let me know where you're tuning in from. Say hello, don't be a stranger, join the community. And if you've got a question you'd like me to answer tonight, make sure you go ahead and pump that into the feed. It's a first come, first served basis. I'll try to get to as many of those questions tonight as I possibly can. So again, welcome to the show. So tonight we're talking about the exposure of gluten in the mouth. And so I think it's first important to understand, a lot of people say, oh, come on, gluten causes damage everywhere, including the mouth. Come on, Dr. Osborne, you're trying to pull our leg. No, these are what I would call the vicious cycle, in a sense, of how unmanaged gluten sensitivity can actually contribute to damage to the mouth. So one of the ways that we can see unmanaged gluten sensitivity create damage in the mouth is through, and this is not always the case, but some people that get gluten issues vomit. They have projectile or cyclical vomiting. And remember, just like in anorexics or bulimics, when they binge and purge, that excessive vomit is very acidic and it neutralizes and destroys the enamel on the teeth, setting the stage for a dry mouth, for redness, for chronic sore throat, and erosion, again, of that tooth enamel. So that's one mechanism, is just this vomiting component. You don't have to have vomiting. Maybe you're not dealing with the vomiting issue. For some people, it's not that obvious. It's more like a regurgitation. And so if you struggle with like heartburn, if you struggle with indigestion, gases and fluids coming up into the mouth because you deal with a lot of indigestion, this regurgitation can also contribute to these symptoms as well. Aside from these two, we know that gluten can alter the microbiome in the mouth as well. So it can change the nature. There have been a number of research studies that show that how gluten can change the nature of the types of bacteria that thrive and help your oral hygiene. And so the alteration of these different bacteria can also contribute to the dry mouth, the redness, as parts of the problem. Again, when you have this chronic dry mouth, understand, first of all, maybe it's a good idea to talk about, why is the mouth important in all this, aside from the obvious. So in your mouth, you've got your teeth, and what do your teeth do? They chew, right? And so what does that do? It breaks down food so that it breaks it down mechanically so that it's easier for you to digest. Why is that important? We're after nutrients, right? I mean, otherwise, who needs teeth? Liquefy your food, you don't need them, right? This is one of the struggle as the elderly start to lose their teeth and have dentition issues from cavities or chronic oral tooth pain. They don't chew their food as well. They become more malnourished. So we get, with reduced food chewing comes reduced nutritional absorption, nutritional breakdown. So this is going to affect you for the rest of your life. So take care of your teeth today and don't wait for them to start falling out to try to start taking care of them. So the mouth is very important, but also saliva. In your saliva, you produce antibodies that help protect you from environmental toxins. that you bring into your mouth when you do eat. So antibodies like SIgA is an example. Secretory immunoglobulin A is a type of antibody that we produce. It's very beneficial for overall immune system function. But you also produce enzymes like amylase. Amylase in your mouth helps you digest carbohydrate. So your saliva is an important component from an antibody, from an amylase degradation of carbohydrates. The digestion begins in your mouth. So again, going back to this, so the reason why we break this down is because if gluten is creating dry mouth, right, and your saliva production is reduced, you could also potentially have a reduced antibody production along with lowered levels of amylase being secreted in your saliva to digest and break down your food, which again means what? Poor digestion. When you have poor digestion, we already know gluten by itself can cause damage to the stomach and the intestines, leading to poor digestion, but poor digestion can lead to that regurgitation, which then just kind of feeds this chronic cycle again, over and over and over again. So it's important to understand that gluten exposure, aside from vomiting, just the damage and the decay that it can do to the mouth through some of these mechanisms, very important. And then when that happens, we get worse nutrition, right? We get poor digestion, we get worse nutrition. So that means we're not getting adequate nutrients, okay, for good oral health. We're not getting what we need. What are those nutrients? We'll talk about those. Stick with me. We're going to talk about those at the end of the show. But it also increases the risk for tooth decay. So now we're losing our teeth, which again, mechanically help us to chew and break down that food, which can lead to poor digestion. So there's two ways we can have poor digestion. One is through chemical loss, right? Chemicals like the amylase help us break down our carbohydrates, chemically speaking, and then teeth mechanically, okay? So we've got, going back over here, when you're not digesting, when you're not absorbing nutrients as effectively and you're getting poor nutrition, your teeth begin to decay. When your teeth decay, it just basically cycles back up to this, right? And this creates issues with chewing and digestion, more malnutrition. It's a very, very vicious cycle that can occur. So again, we want to understand that gluten can do that. So if you're on the fence about whether or not you should be on a gluten-free diet, maybe you know you should be, vanity sometimes helps people or encourages people to make better decisions. So if you're that type of person that's going to make a decision based on vanity, think about how you're going to look when your teeth decay and they're in pain and you end up with a mouthful of either dentures or a mouthful of implants or veneers or whatever else it might be. From a vanity perspective, that's not going to, people that have poor oral hygiene and bad teeth are generally just not attractive in other people. That's going to affect your relationships. It's going to affect the way other people perceive you. That's just the world we live in. So don't get mad at me. Maybe use this as motivation to do the right thing and eat food that doesn't damage your oral cavity. So let's talk about some of the other symptoms of gluten exposure in the oral cavity. So in this diagram here, we said this before, these are symptoms of, we'll just draw it in, of gluten mouth exposure. So number one is gingivitis, inflammation of the gums directly. And so this gingivitis, as the gums are inflamed, they'll start to recede. That's going to make it easier for your teeth to begin to decay. Gingivitis is kind of the earlier symptoms associated with tooth loss coming your way. We know that, as I mentioned a minute ago, we know that bacterial changes can occur with the consumption of gluten in the mouth. And so some of those bacterial changes will dry out the mouth or will start to create problems associated with enamel. This is going over here with enamel issues around the teeth as well. And I'll show you, actually, let's just go ahead and pull that up. Let's talk about some enamel defects and show you some pictures where you can really see what this kind of looks like. So in this diagram, this was actually published in the Journal of the Canadian Dental Association. These are just images of what grade 1 through 4 enamel defects look like. So you can see in this case, in grade 1, the enamel defects, multiple white and cream opacities you can see on the teeth directly. Now, these are pediatric teeth. These are children. In adults, this can look very similar, but you won't have the jagged ridges on the base of the teeth. Now in figure 2, you can see grade 2 enamel defects, rough enamel with surface with patchy symmetric opacities and discoloration. So if you kind of zoom in on that, you can see some of the patchiness in the whiter areas of the teeth starting to occur. And then we have grade 3, which really starts, you can really start to see in it showing up, and you've got these linear components running across the center of the tooth. Let's back that out and move that out of the way so you can see it. But again, this is quite severe. You don't want it to get to this point. This is, when your enamel goes, then your cavities or your caries can really start to form. And then this final picture, you can see this is the tongue here. This is the lower teeth. And then you have right here that I'm circling, that is an aphthous ulcer. So an internal ulcer on the side of the cheek. This is another common manifestation of gluten sensitivity in the mouth. So if you ever had fever blisters inside your mouth, these are also called aphthous ulcers. If you've ever had fever blisters around your mouth, canker sores, if you will, on the lips or around the corners of the lips, these can all be manifestations of gluten exposure orally. Now, a lot of doctors will say, okay, if you've got canker sores or aphthous ulcers, they'll blame this on a virus, right? The herpes family of viruses usually are the culprit or the blame for this. But I have seen countless cases of this type of problem go away in people going on a gluten-free diet. So this is very, very common to see aphthous ulcers that are chronic. And so if you struggle a lot with mouth sores, aphthous ulcers, canker sores, going on a gluten-free diet might just be the thing that you need to do to clear that up. And again, if you struggle with that and you've always just been told it's a virus, think twice. Get checked for gluten sensitivity, because you may not have a virus at all. You may indeed be eating the wrong food. And so that's down here. Again, mouth ulcers and canker sores, manifestation of gluten sensitivity in the mouth. I mentioned this a number of times. Xerostomia, which is dry mouth, is very common. There's actually a disease called Sjogren's. Sjogren's is an autoimmune disease, and it manifests as dry mouth, dry eyes, and tear ducts. So it manifests not just with a dry mouth. So if you struggle with dry eyes, dry tear ducts, dry mouth simultaneously, you might just ask your doctor to check you for this. Now, there's a gluten association with this condition as well, meaning this is an autoimmune disease. We know gluten can contribute to the development of it, and this is why, or one of the reasons why dry mouth is common to develop. And then tonsil stones are another one. And so tonsil stones lead to bad breath. So if you've got chronic halitosis, you don't know why, you brush your teeth on a regular basis, and you just can't figure out why that's happening, tonsil stones just may be the reason as to why that's happening. I'm going to blow this picture up for you because I want you to get a good idea of what tonsil stones look like. So as you're in the mirror in the bathroom, you could kind of see. So obviously this is the tongue, the top of the lip here, and then just back in the tonsils, you'll see these white patches. Okay, they'll form just like that, and they look like little white splotchy patches. I'm going to get that out of the way so you can see it again. But these are called tonsil stones, or otherwise known as tonsillar exudate. And very important, if you have these chronically, this is a hallmark of gluten exposure. What are the tonsils? The tonsils are the adenoids. What do? The tonsils are immune tissue. So, how is it that tonsil stones can form with gluten exposure? They form as a result, or as a direct result, of the food itself. So the gluten stimulates the immune system. Your body doesn't like the gluten, so your tonsils are the first line of defense in your immune system. So as you eat that gluten, your body, your immune system is sequestering white blood cells to the tonsils. It's sequestering them to help fight what you're eating. And so what happens is you get pus and debris basically embedding into the crypts of your tonsils. This is because there's an immune battle constantly going on between you and your food. That's why it stinks, because it's pus and immune system debris that packs into the tonsils itself. And so that's why it causes that chronic bad breath or the chronic halitosis. So if you have gluten exposure, and you are, let me reframe that. Let's say you eat gluten and you don't even know that you're gluten sensitive, but you chronically struggle with bad breath as a result of tonsil stones, you might consider gluten sensitivity as the reason that that's happening and get that looked at or get that checked at. And as you've heard me talk about in the past, the best way to check for gluten sensitivity is not a blood test. The best way to check for gluten sensitivity is to do a genetic test. So again, if you don't know, it's best to get tested so that you can get it figured out. Now, I wanted to show you this too. This is a review, a literature review. So this is a medical review of the medical literature, and it was done by predominantly dentists and published in pediatric dentistry. So you can see here the results. According to some literature studies, prevalence of enamel defects and recurrent aphthous stomatitis. What is that, aphthous stomatitis? This is inflammation in the corners or the cracks of the lips, was observed in approximately 10 to 96%, and this is of 2 to 86-year-old celiac patients. So chronic aphthous stomatitis was observed in up to 96% of patients with celiac disease, ranging from ages 2 to 86, and then the recurrent aphthous, the enamel defects, I read that backwards to you. The enamel defects were present in 10 to 96% of the individuals, and the recurrent aphthous stomatitis was present in 4 to 41% of the individuals, and the age range in this study, or in this grouping of studies of research, was 2 to 86 years of age. So point being, again, these are major problems that are found highly prevalent in celiac, but also in children without celiac disease. You can see the conclusion of this study. The presence, let me back that up. The presence of these clinical features in children may signal the need for early investigation of possible celiac, especially in asymptomatic cases, meaning sometimes these are the only symptoms that can occur. So if you've got children that struggle with mouth ulcers or mouth sores, if you've got children that struggle with stomatitis, the cracking of the lips, etc., is something to consider. Again, check your children too for tonsil stones. Not a lot of research on this one. There's a ton of research on the other things I've talked about tonight. Tonsil stones, there may be a few small scale case studies that have been published in the literature. I actually have probably a couple of dozen within my own practice that I have seen go away as a result of this. So it's not uncommon to see this go away in terms of going on a gluten-free diet. So very, very important that if you've got or struggle with those issues, that you're suspecting gluten as a potential culprit. Okay, now one of the things that we know gluten can also do is it can contribute to poor digestion, which leads to malabsorption, which leads to reduction, in nutrients. So when we have a reduction in nutrients, we get vitamin and mineral deficiencies in essence. This can also impact the mouth. And this is actually one of the reasons why gluten sensitivity can affect the mouth. So aside from the fact that we know gluten can contribute to some of the oral damage through bacterial changes and through inflammatory changes, we also know that lower levels of nutrient absorption occur, and we know several nutrients play a major role in the health of your mouth. So we'll go through some of the kind of more common ones. So looking at this one, you can see iron can cause angular stomatitis, which angular stomatitis is when the corners of the lips start to crack. So if that's ever happened to you, some people it happens more aggressively in colder weather because the lips get really dry in colder weather. But if this is happening to you all the time, think iron deficiency as a potential possibility. Both iron deficiency, also vitamin B2 deficiency can cause angular stomatitis as well. And this leads to, again, it leads to saliva or spit building up in the corners of the mouth, and those microorganisms build up, and that can lead to, microorganisms start to embed in those cracks, and that can lead to painful sores. You've also got zinc deficiency. This is probably the third most common deficiency associated with gluten sensitivity. Iron being number 1, vitamin D being number 2, zinc being number 3 in terms of my experience working with a lot of people with gluten-related issues. But zinc deficiency is very, very important. Zinc being too low can actually cause your mouth to become very dry, and it can give you susceptibility to gum disease because of zinc's role that it plays in the production of proteins that are important for collagen formation. Zinc also, though, when it's low, starts to affect taste. And many of you talking right now about the Rona have lost your ability to smell or taste. And this alters what happens when taste and smell change is we generally tend to gravitate toward foods that are higher in salt or higher in sugar to get flavor from the food. So it actually can compound and lead to poor dietary choices as a result of seeking out flavor. We also know that B1, B2, and B3 can cause inflammation of the tongue, something also referred to as glossitis, inflammation of the tongue. And very, very common. So the tongue would be beefy, it would be large, and it would be red. And some people actually have glossitis, and because they have glossitis, it closes their airway, and then they can't sleep very well, and then they go on and they get a diagnosis of sleep apnea. So those of you may be struggling with sleep apnea, but you don't know why, have your doctor check your tongue for glossitis. If it's swollen, then you want to start asking, why is it swollen? Could it be a B vitamin deficiency? Could that B vitamin deficiency be caused by gluten, right? Gluten exposure. And if it is, the simple solution is change your diet, change your nutrition. And that might change your sleep, and that might improve your energy, and that might help you with weight loss. Again, these are cycles, right? So additionally, aside from inflammation in the mouth leading to pain and in bleeding, gum decay, right, makes it difficult for you to chew or to speak. So it can start to impact, how you chew your food. If you're bleeding, if there's pain, you're going to be more cautious around chewing and around your food, and that's going to affect your nutrition even further. Then we have B12 deficiency. Now, also, B12 deficiency can also cause glossitis. It's very, very common. But it can also lead to bone loss around the teeth. B12 deficiency, actually, I've talked about this before, can elevate a chemical called homocysteine. And homocysteine leads to bone loss. Elevated homocysteine leads to bone loss. And it's a risk factor, has been identified as a risk factor for bone loss, as well as heart disease, which is what most people know this chemical for, is its risk factor associated with heart disease. But B12 deficiency elevations can create elevation in homocysteine, causing more decay in the bone of the teeth. B12 is also important to form some of the elements of teeth, and so this is another reason why we'll see periodontal disease begin to develop with severe enough vitamin B12 deficiency. B12 can cause painful ulcers in the mouth to form as well. So aside from glossitis, aphthous ulcers can also form. We know that vitamin D deficiency, one of the side effects of vitamin D deficiency is an enlargement of the adenoids, so your tonsils get too big. And how many of you grew up, just the audience, polling the audience tonight, how many of you grew up and had your tonsils removed or had a tonsillectomy or an adenoidectomy? Just say yes in the feed if you've had a tonsillectomy or an adenoidectomy. And, I say that because I want to point this out. Vitamin D deficiency is one of the top deficiencies in gluten sensitivity. How many people develop enlarged adenoids as a result of not having the ability for their immune system to properly regulate, so those tonsils will swell? When your tonsils swell, aside from those tonsil stones and the bad breath, right, but it can compromise tooth integrity, and it can create abnormal patterns in the alveolar bone of the jaw. Why? Because you need vitamin D to absorb calcium. Remember, when you eat calcium from your diet, the vitamin D is what tells the intestine cells, the small intestinal cells, to absorb that calcium from that food, and that calcium then gets deposited into your jaw, right? And so if you don't have adequate D, then there's a disease called rickets, which is a vitamin D deficiency that leads to softening of the bone because calcium absorption is affected as a result of the vitamin D deficiency. Now, one of the other things, let's make a little room here. One of the other things I want to talk about in terms of this loss here, this bone loss that can occur with vitamin D deficiency, is that steroids, chronic use. Now, we're not talking about a one-time or a one-day use. We're talking about consistent use of steroids, 6 months plus. Steroids deplete D, calcium, and magnesium. Those are nutrients depleted by steroids. So maybe you're taking steroids for chronic pain, or maybe you've got a problem in your mouth, a chronic inflammatory problem, and your doctor's giving you a steroid to apply. Again, understand that steroids cause bone loss. So if you've already got an issue here, you could exacerbate it. So if you've been put on a steroid for mouth inflammation, you want to talk to your doctor because, again, steroids can compromise the bone integrity. One of the other things that oftentimes is done for osteoporosis, or people that think they have osteoporosis, is they go on a class of drug called a bisphosphonate. And what these drugs do is they cause microfractures in the jaw. The reason I say this is a lot of you that follow the show have chimed in the past about osteoporosis. This class of medications designed to make your bone, your bone thicker, actually makes your bone brittle. Yeah, it makes it thicker, but it makes it thicker in a brittle way. And so what happens is there's a disease process called osteonecrosis of the jaw. And again, what you get is microfractures in the jaw, and that can inhibit your ability to eat. So caution around certain medications in your hygiene of your mouth and your health of your mouth. Bisphosphonates, microfracturing of the jaw. Steroids can cause alveolar bone loss in the jaw and make it harder for you to chew your food. We've also got vitamin C. Now, vitamin C is important for forming collagen. The collagen is what your gums are made from. It's a type of collagen. And so if you don't have adequate vitamin C, then your gum tissue can start to break down. Later stage vitamin C deficiency is called scurvy. And one of the side effects of scurvy is tooth loss, right? We'll see the teeth start falling out. And that's because, again, vitamin C helps to produce that strong collagen that anchors the teeth into the jaw. It can cause irregular formation of dentin as well, and alterations of dental pulp. So bleeding gums, delayed wound healing in the mouth. So if your mouth heals very slowly, remember when you get a cut or a sore in the mouth, it should heal in a couple of days. If it's taken longer than that, you might suspect vitamin C is playing a role in that process. And then again, what I mentioned earlier, defective collagen formation leading to B6. Another B vitamin can lead to periodontal disease anemia. So what happens with B6, you can develop a sore, burning tongue. So if you've ever had a tongue that started burning or was super sore, that is possibly vitamin B6 deficiency. But the anemia that B6 causes, this is a tricky one because vitamin B6 anemia can be what we call a normocytic anemia. What does that mean? The way doctors typically diagnose anemia is they do what's called a CBC. A CBC stands for complete blood count. And so what they're measuring are these different markers. One, they're measuring hemoglobin to rule out iron deficiency anemia, which is smart. They're measuring something called hematocrit, which is important as well, and it relates to iron. But they're measuring MC and MCV, which measures size and color of your red blood cells. And a lot of times, these will be normal, but a person will still be anemic. That's called normocytic anemia, whereas traditional anemias, you'll see low values for these markers, MCH and MCV, unless it's a B12 deficiency, in which case you'll sometimes see high values for those markers. But in a normocytic anemia, which can be caused by vitamin B6 deficiency, your blood work can look normal. So it's important, if you suspect that your doctor looks at your vitamin B6 levels specifically. And one of the best ways to do that is to measure them intracellularly. Then we have vitamin A. Vitamin A deficiency can impair tooth formation. So especially in children, lack of vitamin A, lack of vitamin A or vitamin A deficiency can lead to impaired tooth formation, the delayed or an absence of the teeth actually developing. So if a child doesn't have teeth developing appropriately, consider vitamin A as a potential possibility, the deficiency. And then enamel hypoplasia, meaning an inability for the enamel to properly form. but also vitamin A is necessary for the epithelial tissue. That's the tissue in the gums, the tissue around the skin to properly form, and so a deficiency in that will manifest as mouth sores, among other things. As a matter of fact, a number of research studies show that low enough levels of vitamin A can cause GI inflammation that can hinder the gut's functionality and ability to work long term. So a really important nutrient, which is commonly low in those with gluten sensitivity. So this last slide, let's talk about some things you can do. Let's talk about actionable steps you can walk away from tonight's class that you can do to optimize your oral health. And so number one, obviously, that's avoid gluten if you're gluten sensitive, because all those things we just talked about can be problematic. But some other things that you can do, number one is intermittent fasting. Remember, your mouth needs a break too, just like your gut. Intermittent fasting increases healing time. It accelerates the production of stem cells, and that leads to a more aggressive, faster healing. So intermittent fasting, and there are different strategies. If you want to learn more about this, go back and watch in my video archives. Go back and watch. I did an episode on intermittent fasting and talked in much greater detail about it. Avoid antibacterial mouthwash. Look, we're exposed to enough antibiotics through the chlorine in the water, the fluoride in the water, the bromine in the water, through the antibiotics in the meat. You don't need to add to it an antibacterial mouthwash. This can alter your microbiome and actually create problems. Probiotics. Using probiotics, oral probiotics, can be very helpful. There's more and more research coming out on probiotics for oral health and for gastrointestinal health. Very, very important. And you can take probiotics not just in a pill or capsule or a powder. You can also take them by eating foods that are rich in probiotics. So foods like sauerkraut or fermented cabbage, fermented carrots, fermented cauliflower, all good options for a good probiotic to add into your diet. Avoid acidic foods. Now, this doesn't mean that you can't eat a tomato or citrus, but if you've already got enamel erosion, if you've already got decay, again, those teeth are going to be more susceptible. So before you eat a bunch of acidic foods, work on these other things and consider acidic foods as maybe something you want to avoid, or at least a lot of them, at least temporarily, as you work on improving your oral health. And then nutritional testing and supplementation. Again, start with testing. This is what I recommend. Start with testing and then supplement according to how your testing is coming back, because if you're low in certain nutrients, of course, that can lead to your oral health declination. And then the last thing is testing for food sensitivities, because tonight we focused on gluten, but gluten, the way it works for most people is it creates an inflammation, right? And can other foods cause inflammation? Sure they can. Absolutely, they can cause inflammation. So be aware of that. As a matter of fact, I've seen cases where people had such severe gum disease and such severe oral health issues because of healthy foods they were eating that they were allergic to. So testing for food sensitivities and food allergies is very important, because if other foods are creating that inflammation, they can do just what gluten can do. On another note, something I didn't put up here is a lot of times when you go to the dentist, one of the things they want to do is put you on and increase your fluoride levels, and increasing your fluoride if you have a history of cavities. And so don't do this in lieu of the potential to investigate for food sensitivity or gluten sensitivity, because fluoride is actually an antibiotic. It's a natural antibiotic, so it can actually make the problem worse. I've seen cases where dentists put people on special fluoridated mouthwash and toothpaste, and it actually worsened the problem. And so when I say the problem, it increased bleeding of the gums. And I've also seen people who were allergic to some of the fluoride ingredients in many toothpastes, and again, worsening of this situation. So be aware that fluoride, which is a common solution that dentists give as a kind of catch-all, hey, you got a problem in your mouth, you got extra cavities, or you have bleeding gums, here's more fluoride, right? And oftentimes this can worsen the problem. So go back and look for the root cause. Nobody has bleeding gums as a result of fluoride deficiency, because fluoride in and of itself is not an essential. It's not an essential nutrient. The body does not need fluoride to survive or sustain function. So be cautious of using abundant quantities of fluoride. Okay, let's open it up for your questions. Oh, I like this one. Barb chiming in. Please discuss dentures, partials for those who have lost many teeth. What should dentures be made out of? And should the teeth be plastic or porcelain? Are there gluten-free, non-toxic dentures? You know, this is one of those, if you require dentures, you need them to chew your food to maintain your nutrition. So it's really about picking the least toxic option that you can have. Now, one of the things that you can do, one of the things you can ask your dentist to do is ask your dentist to do what's called oral compatibility testing. What does that mean, oral compatibility? Before they put something in your mouth, let me spell that right for you. Oral compatibility testing, I really mangled that, is testing you to see which kinds of materials that he's going to use that would potentially work against you or that your body would react to. And a lot of dentists do this, and especially if you, when you're going to a dentist, try to find a dentist that has been certified through IAOMT. These dentists are more natural. They're what are called biological dentists. They're going to have it's almost like functional medicine versus traditional medicine. These are the functional medicine dentists. They're interested in things like oral compatibility. They're interested in using less toxic materials in your mouth because they know that putting the wrong material in your mouth could lead to an unsuccessful outcome for you. So doing oral compatibility testing first before you make the decision of what you're going to choose to use, because I've seen cases where people were allergic to some of the dental ingredients that they had placed in their mouth, and it was creating a lot more problems. So oral compatibility testing is the first thing. Some, you have to be careful whether or not they have gluten. So the other thing that you always want to make sure that you do is anytime you put any type of device in your mouth and this is whether it's surgery in your mouth from a dentist, there's something called a materials data sheet, and you can request this materials data sheet. Anytime you're putting something in your mouth, the manufacturer has, what is that made out of? What are the cements and the glues made out of? Do they have gluten? There was a study a couple of years ago on a child with celiac disease, had not dentures, but had braces put in, and the adhesion in the braces had gluten in it, and so the child was reacting very seriously to the braces themselves. So always get a material data sheet from your dentist to make sure you're not affixing something into your mouth with a gluten-based adhesive that could potentially create problems for you. The connection between bleeding gums despite perfect hygiene and ulcerative colitis flare. Well, I mean, bleeding gums are inflamed gums, and colitis is an inflamed colon. And so if you're doing things, if you're eating foods or you're being exposed to things orally that are creating inflammation, it can affect not just your colon, but it can also affect your mouth and your gums. So even with perfect hygiene. So I would think there in that situation, I would either think what medicines that could be contributing to that problem, or I'd be thinking what foods or chemical exposures might be contributing to that problem. Let's see. Do I think that gluten should be avoided in individuals that do not have chronic illness and also test negative? Not necessarily. Again, that goes into, should we avoid gluten if we're not gluten sensitive and we're healthy? Maybe not. Now, some people would argue that. I would say if you have a really strong, robust, healthy digestive tract, you should be able to tolerate gluten if you're not gluten sensitive. But that being said, you then have to start evaluating the quality of where that gluten is coming from. Is it organic? Is it sprayed with pesticides? Is it a GMO type of grain? Like, these are all questions that you have to ask beyond the gluten element that play a role in how healthy one of these food items might or might not be. This is a good question. I understand that wild rice is grain-free. Was wondering why the bag of wild rice says whole grain. It shouldn't. That's just the ignorance of the manufacturer of that product. On that note alone, I probably wouldn't buy that product from that company because they don't take enough time to even understand what they're putting on their own label. But it shouldn't say that because it isn't a whole grain. Can someone only be sensitive to alpha-gliadin only, leaving them okay to eat other forms of gluten if it's organic? No, I haven't seen that be the case. So no, don't. If you're gluten sensitive, don't just avoid alpha-gliadin, avoid all forms of gluten. So Claudia says, I get cold sores every other 2 months or so, and I didn't know why. I even eat gluten-free only. Well, I would consider, Claudia, if you're eating the traditional, if you don't know the difference between traditional gluten-free and a true gluten-free diet, you might want to consider how gluten-free you actually are. Go to glutenfreesociety.org and sign up for our newsletter there, and we'll send you an information packed on the differences between the types of gluten-free diets that people follow, because you may be getting gluten, you just don't know it because you don't have the full understanding of what gluten is. And then there are other things as well that can cause that problem. So cold sores are not explicitly solely caused by gluten. There certainly are other things, but gluten is definitely one that you want to look into. Let's see here. I love that. Thanks, Donna. Donna says, hello from Florida. Thank you for all you do for us. The master class was awesome. Thank you, Donna. So glad you enjoyed it. Glad it was helpful for you. Is the sweetener Dolcetti, which contains organic apple juice concentrate, safe to use as a natural sweetener? It has a glycemic index of 22.5. Now, I haven't really looked at that one, Mary. I would say look at all the ingredients, and depending on what other ingredients it might have, you might consider it as safe or not safe, depending on what other ingredients it might have in it. I personally don't like any kind of juice from concentrate. I think concentrating sugar is probably not a great idea, especially since tonight we're talking about the oral health. Concentrated sugar in the mouth equals concentrated cavities and deterioration of the oral health. Now let's see, Margie. My gums hurt often. My dentist wants me to use fluoride non-whitening, non-plaque removing toothpaste, but I refuse. I use Jason fluoride-free toothpaste. No gum disease. So I didn't see the question in that, Margie. Maybe that's just more of a comment. How does burning mouth fit in with food sensitivities and leaky gut? So burning mouth can be, Dan, it can be a number of different things. I've seen burning mouth be associated with B vitamin deficiency. I've also seen it be associated with mold or metal toxicity. And so if we're talking about mouth, one of the metals is mercury. Mercury toxicity, especially if you've got old amalgams that are silver-based amalgams leaching mercury, that's something that we'll sometimes see associated with that problem. But mold in your environment can also create that burning mouth or that burning tongue issue as well. Does oil pulling help keep the mouth bacteria down? I'm not a big fan of oil pulling. People that do it every day, I think it's a bad idea. Coconut oil, using heavy amounts of coconut oil on a daily basis. Remember, coconut oil is a natural antibiotic too. And so just like we want to avoid the massive use of antibiotics when it's unnecessary, pulling with coconut oil every day, in my opinion, is not the greatest of ideas. If you did it here or there or occasionally, especially if you had like a problem you were trying to address with it, then you might try to use it. But I just don't recommend it on a regular daily basis. Could gluten have caused parotid and submandibular gland pleomorphic tumors? I had to have both glands on the left side removed. I'm now on grain-free, dairy-free diet, but I've lost most of my teeth. You know, Cheryl, there are studies that show gluten can cause oral cancers or mouth cancers. I've not seen anything specific to those tissues or to that type of tumor as it relates to gluten in the medical literature, but that doesn't, again, it's hard for me to give you an answer because I'm not familiar with anything, or I'm not aware of any research or studies that have been done in relationship to that. So I think if it did cause yours, it would be purely anecdotal. We would be saying purely anecdotal in that regard. Does health insurance pay for genetic testing for gluten sensitivity? Depends on your insurance carrier, depends on your doctor's knowledge of which genes to actually look at and which genetic alleles to actually look at. It possibly could, but again, without interpretation, you may be getting the test without interpretation, which wouldn't be a whole lot useful for you. But again, that's just what your insurance covers is between you and your insurance company and between the doctor making the claim of medical necessity, meaning you have a medical necessity to order that test and have your insurance cover it. Lots of tonsillectomies in the room tonight. Oh, I like this. So, dentist traumatized a molar years ago and it died. I've suffered flare-ups over the years. The doc wants to extract the tooth, but it's quiet since going gluten-free. Can I keep this tooth if I stay gluten-free? You know, I'm not a dentist, and I don't have the benefit of actually doing an oral examination on the mouth for you and being able to help you make that determination. You know, you might get a second opinion. If one of your dentists wants you to pull it, you might get a second opinion with the doctor. Go to IAOMT.org and see if you can find a doctor who's certified biological dentistry and who's in your area. That might be kind of a better way to go about it, is just get a second opinion. Because again, the problem with a dead tooth in the mouth could be that might be a hotbed for a future infection or a hotbed for decay. If the tooth is truly dead. And that's where you just want to get a qualified dentist to be able to render you a good opinion so that you don't end up in trouble. Let's see. So I like this. Sarah says, since I went off dairy and eggs, take your calcium and magnesium, my teeth are actually getting whiter. Oh, where'd it go? They were always on the yellow side since I was a kid, grain-free since July 2019. Thanks for that testament, Sarah, to the power of diet change and supplementation. So again, maybe some of you have been asking about yellowing of teeth as a potential. Well, Sarah's testimonial there is a pretty good place to start, diet change. Root cause of a fissured tongue. You know, if you've got a fissured tongue, if you've had it since you were an infant, since you were a baby or you were born with it, it could have just been a birth defect in the womb. So it's hard to know. There definitely could have been something in the development during gestation that occurred that led to that. Just like cleft palates and other forms of neural tube defects. Jackie's asking about ozone cleaning or ozone treatment at the dentist's office to flush after cleaning. I think if that's what your dentist is recommending, it's probably not a bad idea. Ozone can be a very potent agent to flush out, especially if he's trying to flush out any type of infectious decay or debris. Mark's asking, I had a root canal 25 years ago. Should I have it removed even though I have no health problems so far? Mark, what you can do, get with a good biological dentist, can ask for a cone beam x-ray. And what they can sometimes identify is an infection under the tooth. You can have them asymptomatically, but if you do that, that's going to give you a better idea. But again, I can't tell you whether or not you need to have it removed or not, but a good biological dentist doing a cone beam x-ray might be able to get you a better answer. Can celiac disease cause hair loss? Yes. We did a whole show on that once, Alex. Particularly alopecia of an autoimmune nature, it can create that because it from an autoimmune perspective can create an autoimmune response against the hair follicle, leading to patchy-like hair loss. Alopecia areata, alopecia universalis are two of the forms of autoimmune hair loss. But it can also lead to malnourishment, right? And malnourishment means low levels of protein, potentially low levels of nutrients that are necessary for hair growth and the health of your hair, which can lead to thinning of the hair and then diminished hair as well. Castor oil for oil pulling. Don't recommend it. What's the best way to test for food sensitivities? There's multiple ways, Jennifer. It's not one particular methodology, but there's 6 different methodologies that need to be looked at. IgE, IgA, IgM, IgG, immune complex, and T-cell response are the 6 different ways that we know of that the immune system can react to food. So it's a combination of those different things as far as being accurate and being thorough. A lot of doctors only measure something called IgG subtype 4, which is not the most accurate way to measure for food sensitivity. Can gluten cause high blood pressure? It can. Go back and watch our show on gluten and cardiovascular disease for more specifics on that. Yeah, so since cold sores are often blamed on a virus, can it still be a virus when you have HPV in your system? It can be, but I've seen a number of people with HPV, human papillomavirus, with cold sores as well. When they go gluten-free, they no longer have cold sores, but they still have HPV. So it's possible, but at the same time, gluten's a major factor in that. As a matter of fact, a colleague of mine did a study a number of years ago and found the number one silent symptom of gluten sensitivity was the formation of frequent cold sores and aphthous ulcers. Okay, let's see here. What's the difference between making my own potatoes in olive oil baked in an oven versus potato chips in a bag? The biggest one, Jane, is the level of heat used to fry those chips that you're buying in a bag creates a process or creates a compound called acrylamide. Acrylamide is what happens when you overheat a carbohydrate, and it's a carcinogen. It's classified as a carcinogen. So those potato chips, a bad idea. Anytime you get something like a fried potato chip, not healthy. Even if it's organic, even if the oil they fried it in is organic, don't fool yourself. Fried potato chips are not good for you. That's not to say that you guys aren't going to probably eat them from time to time, but you shouldn't justify the daily use of that just because they're organic and cooked in organic oil. Jenny's asking, does that mean no nano silver mouthwash? Probably referring to what I said earlier about coconut oil being a natural antibiotic. You can still use a silver mouthwash. Its antibiotic activity is not super great, and you're not sitting it in the mouth. You're not, hopefully, if you're using it, you're not holding it in the mouth for 15 or 20 minutes. You're just rinsing out and spitting it out. So you're not going to get that longer base exposure that you would get when you're doing oil pulling directly. Nicole's asking me, do I eat potatoes or dairy? If I'm going to eat dairy, it's A2 milk. A2 from my own cows, because I'm just fortunate enough to live on a farm. I can do that. But your regular grocery store dairy, I wouldn't recommend that. It's typically A1 milk, which is known to mimic gluten and create problems. As far as potatoes, yes, I do eat potatoes, although not in overabundance. Where people get in trouble with potatoes, not that potatoes are bad for you. Actually, they're rich in potassium and many other minerals, rich in vitamin C. It's the quantity. It's the baked potato that they load up with sour cream and cheese and butter and bacon and all that other nonsense. So it's the fillings more than anything else. But yeah, when I sit down to eat some potatoes, it's usually a half a cup or less. So I'm not getting that carbohydrate load and certainly not smattering it in all kinds of processed dairy foods in that baked potato fashion. Good questions. My tongue is sensitive to acid like oranges, apples, and most fruits. Do you have any thoughts? I mean, yeah, you could have reactivity to those foods, and that might be part of why your tongue is sensitive to them. It may not have to do with the acids per se as much as it's the sensitivity is to actually the sugar in the actual fruit itself, creating kind of an excitement of bacteria within the oral cavity, creating a problem. So, for some people, Jackie, we actually put them on a really low carbohydrate diet for a little while and see if that's beneficial or helpful. And you might make that attempt and see if your tongue sensitivity doesn't improve. Next question, Marcus wants to know, what about sweet potato chips? Same thing, Marcus. Sweet potato chips fried in oil at high temperatures also produce acrylamide. So yeah, you got to be cautious and careful about that. Have I heard of teeth grinding as a sign of gluten sensitivity? Yes, Esther. That's called bruxism, Bruxism, and it can be a sign of gluten sensitivity. It can also be a sign of malnourishment. Bruxism is commonly present in people that have calcium deficiency or oftentimes magnesium and sometimes even potassium. These three are super important for the maintenance of muscle tone. And so what happens is you get tightness in the masseter mandibular muscles, and you grind or you clench when you go to sleep at night. And this is not so much like a disease per se as it is an imbalance, an electrolyte imbalance. And again, why gluten can cause that is because gluten can deplete calcium, magnesium, and potassium and lead to that type of symptom. So yes, the grinding. So if you've been to a dentist and you told you need a mouth guard, you may need a mouth guard, but you may also just be deficient in some minerals and you need to get that corrected. So White Space Marine says, shouldn't I pay attention to my body and what it tells me? Doctors tell me high carb, low carb, etc. But when I cut out grains, I feel so much better, but I gain weight. So depends on the kind of weight that you gain. So, yeah, you should listen to your body. That's the first rule of nutrition, right? Well, it's actually the third rule of nutrition. There's 3 rules. You can't get healthy eating food that's not. Don't eat what you're sensitive, allergic, or intolerant to. And listen to your body is the third rule. But sometimes when you listen to your body, there's conflicting information. So like if you're not eating grain but you're gaining weight, the issue probably there is that you're eating too much calories overall, and probably in the form of fat, because a lot of people gravitate away from grain and they go more toward heavy base of nuts. And so again, it could just be a caloric excess that's creating for you. So it just depends. But yes, listening to your body is definitely a smart thing to do. Let's see. What whole house water system? So that's a good question. There's not like a particular brand, one brand over another for a whole house system. What you're really looking for, depending on your water. So think of your water filtration and your water system as what's your need. So like if you have well water, generally speaking, GAC, granular activated carbon, and KDF, and what's known as a 0.5 micron carbon block, these are great filters. And the reason why is you don't have fluoride and you don't have bromine. Whereas if you live in the city, you want all these things, but you also want reverse osmosis. Attached to that water filtration. Some people go for UV, so having their water run through UV light, ultraviolet light, that's not a bad idea because it helps to prevent the microorganisms from showing up into your water, especially again if you're in the city. That UV light, remember you're pulling. City water filtration is something that, in my opinion, over time has deteriorated and become more chemically dependent, and they use a lot more ground surface water, which has a lot more chemicals and pollutants that their filters can't pull. Remember, the job of city water filtration is really to make sure there's no microorganisms in the water that would cause an epidemic of disease spreading from the water contamination. Their job is not to pull out, the chemicals as well. And so that's where RO combined with this KDF right here can be some of the most effective. So looking at where you live, the best thing to do is call out a reputable company and have them test your water, get a water report from your area to see which strength of these different filters and which combinations would be best for you in particular. It's just like your health. There's not like a one size fits all in health. There's not like a one size fits all with water filtration either. Let's see here. Yeah, so a couple questions about about cleaning products. Castile soap is grain-free. That's probably one of your better options as far as like cleaning and being in the shower. If you're talking about there's also soaps that are made from things like other natural oils like coconut that you can get as well that are grain free as opposed to containing things like oat and wheat germ, etc. Let's see, scroll down on the left for me. What's my take on root canals? Like I've been faced with needing a root canal when I was a kid. I grew up pretty broke, and by the time I was an adult and I had this impaction of wisdom teeth coming in the back of my mouth, they told me I needed a root canal. I opted to not do a root canal. I opted to remove the tooth and have an implant put in. And the reason why I opted that is because the root canals, that you run the risk of that dead material being in your mouth, running the risk of potential for a big time infection and other health problems. So again, that's my take on it. I would encourage you to talk to a dentist who's IAOMT certified. Those guys, in my opinion, are the sharpest of the sharp in the realm of dentistry. How can celiac affect your tongue? I think we kind of answered that already. We talked about earlier about glossitis, swollen tongue, and lesions on the tongue directly, all potential possibilities. Let's see here. Did I miss one? No. Go all the way down there. Okay. Up to, sorry. Trying to find a good question here. There's a lot of off-topic questions. I don't want to get too far off topic here. What's the best toothpaste to buy? Depends on the person. I mean, there's a number of good brands. Kiss My Face, Jason is a good brand that most of you can find in a local grocer. But those are decent brands. Let's see, is exfoliative cheilitis a gluten sensitivity problem? It sure can be, Nia, so that's something you might want to look at. What are the signs of irritated tongue due to gluten sensitivity? I think I answered that a couple of times now. How can celiac affect your tongue? I answered that one as well. Is it okay to use hydrogen peroxide in a water pick to keep bacteria down in the mouth? It is, and hydrogen peroxide is actually an ingredient in a number of toothpastes. It's a really benign ingredient. It's one of the best, really, in my opinion. It's actually one of the best ways to keep fungus down. So if you struggle with chronic mold or chronic mold issues, that's one of the best ways to get rid of it. A lot of people want to apply like oregano oils or thyme oils or other antimicrobial oils or antifungal oils, but I find hydrogen peroxide to be probably the most effective of everything when it comes to a fungal issue. Should you get your old fillings out, the ones with mercury? Lynn, that's a good question. It's not a yes or no answer. I think more than anything, some doctors would tell you yes. I'd more fall in line with if it's not broke, don't fix it. If the amalgams are not emitting massive quantities of mercury and creating mercury poisoning, then getting them out, you run a risk of mercury poisoning. Even if you're using a biological dentist and they're damming you right and properly and using the right fans. But the best way to decide that, in my opinion, is to do mercury testing. So actually do what's called a pre and post provocation test to measure whether or not mercury is a problem. If it is, you need to get the amalgams out. Okay. Oh, we went too far, I think. Keep going. No, go down. How about organic, non-GMO popcorn? Thanks for asking the question, Sue. Just the nature of that question lets me know that you probably are new and you've got a lot of learning to do as it relates to what is a gluten-free diet, a true gluten-free diet. What I'm going to encourage you to do is go to glutenfreesociety.org and sign up for our newsletter, and I'll send you a bunch of free information about that. But to answer your question, since you're here tonight, no, organic non-GMO popcorn is not okay if a person is gluten sensitive. It's a major train wreck of a problem waiting to happen. Is there a weight gainer supplement recommended for a 15-year-old boy with a tall, thin frame? You know, best weight gain supplement, probably creatine monohydrate. It's long safety track record. It's not going to do any damage, but it'll help that 15-year-old who's trying to do more weightlifting and working out, put on mass and strength more quickly. Other than that, protein, specifically amino acids broken down. So I have a product called Ultra Aminos that would fit that bill really, really, really well. Also something called Ultra Pure Protein that would fit that bill really well. Let's see here. Keep going down. Severe irritation in the ears for several years. Doctors don't know what it is. Itching, stinging, flaking. One recommended a steroid cream. Could it be a reaction to gluten? It's possible. I mean, the only way you're going to know that is really go gluten-free. And if you're not willing to commit to that, then test to see if you're gluten sensitive, and then, honor whatever you find. Is there a grain-free toothpaste? Yeah, there are lots of options for grain-free toothpaste. Again, I think I mentioned two brands earlier. Jason and Kiss My Face are two brands that you can get grain-free toothpaste from. Do you need vitamin K2 with your vitamin D? No, you don't, but you can take them together. There's a lot of, I'll just say there are a lot of internet folks chiming about how dangerous it is to take vitamin D without vitamin K2, and that's not true. That's mostly hype and mostly people who've read one or two studies that are not the end-all be-all. It's very fine to take vitamin D without vitamin K2. You can also take them together, and there's nothing wrong with that either. Okay. Man, we're already 10 over, aren't we? Wow, where did the night go? So, if I didn't get to your question, I apologize, but we're right on the time, and we got to check out. So, again, if you're new to the show and you're new to Pic Dr. Osborne's Brain, I come back every Monday at 6 p.m. We do a live Q&A. Come back and visit. And if you want to get notifications about the show, make sure you come subscribe. You can do that at glutenfreesociety.org. Subscribe to our newsletter. You can also do that on our YouTube channel. Just hit the subscribe and the bell, and you get notified when we go live. Again, we do a live show every Monday night, and I post 4 to 5 videos a week. So if you want to learn and get educated and do more to improve your health, come join us at youtube.com/glutenology. This is Dr. Osborne wishing you excellent health and wishing you an excellent week. We'll see you next Monday for another episode of Pic Dr. Osborne's Brain. Take care. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pic Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.